Welcome back to Men's Health. Women have menopause. The question is, do men have a biological clock? And should women be interested in men's health? With us, Dr. Harry Fish. And Dr. Harry Fish happens to be the author of a very important and very interesting book, The Male Biological Clock. So, Dr. Fish, do men have a biological clock?
Well, absolutely men have a biological clock. You know, when we talk about biological clock, we think about women. That's a decline in hormones as they age, decline in fertility, and an increased chance of having babies born with genetic problems. Well, guess what? That's exactly what's happening for men. That is, testosterone levels decline, and people need to know that it declines about 1% per year after the age of 30, but some men it declines really wickedly. And these are the men that have an accelerated biological clock, something that they have to be worried about. And of course, fertility declines as we age. People don't want to hear that, but it's true. And unfortunately, the sperm of older men are associated with more problems with their offspring with genetic problems.
Dr. Fish, I'm so glad that you mentioned that, because what happens with men is there's a gradual transition, a gradual loss of testosterone, and yet even a slight loss can result in some diminished erectile capacity. Then he overreacts to that and causes a complete erectile dysfunction. And all of a sudden he just feels like, I'm not myself anymore. And then it becomes like, who wants to do what they don't do well? And there's a total avoidance. And the profound thing for women actually is not merely the lack of sex, but then he withdraws completely. There's a lack of affection, there's a lack of intimacy, there's a lack of time together, and she has no idea why, which is why it's so important that men seek help and that she encourage him to seek help as well.
Do you think it has to do as acceptance? Men have to accept that there's a problem to get things kick-started?
I wouldn't even call it accept that it's a problem. I would say accept the changes that are taking place in your body. You know, I use glasses now, but I don't think of myself as blind, but I do need this extra little assistance, and men as they age need a little more direct stimulation to be able to function. They have to continue to do exercise, but maybe doing a little more walking and a little less running.
Very interesting discussion on men's health, and very interesting concept of the male biological clock. Now, Dr. Harry Fish happens to be also the author of another book, Size Matters, the hard facts about male sexuality, and more interestingly, what every woman should know. So here, Dr. Fish, you mention in the context of men's health, the woman.
Right.
Why did you mention that? What is the role of women?
Well, the women's role is paramount. Essentially, women want to get the information. They want to know everything, and a lot of men are deniers. So what I tell everybody is that women are the ones that really ask the questions, and I always encourage men to get the book. Even though it's written for women, look at the questions, read the questions that women are asking, and then you'll know what women are thinking, because they are much more attuned to the issues of sexuality and health than men are.
I mean, it was so smart of you to write the book for women, even though it's about men, because it's women who buy the books, it's women who educate themselves, and unfortunately, women ask these questions, and we should be asking them too. We should be asking our doctors for information, and indeed, unfortunately, one of the things that we've learned is that our doctors themselves don't provide enough information to men. They provide more information to women under the presumption that women care more about this than guys do, and we need to start caring more about ourselves.
So, Dr. Perlman, can you help us tie all this together?
The issue of putting it all together, that we need women certainly to encourage their partners to be able to seek help. We need them to support the men in seeking help, because we're not going to be able to do it without you. We definitely need your help. And by doing it together, I mean, everyone's life will be enhanced.
So, in other words, we hear all the time that women are the drivers of health in every family. The woman takes the boys to the doctor.
You know better than anyone else. You and I did a study of 21,000 people worldwide, and what did we find? 30% of the men who sought help because their partner encouraged them to do so. The women behind the man is still a critical issue.
So it's a partnership. Women and men are partnered on men's health.
Absolutely.
And women can play a big role in improving the health in men in their lives. Husbands, fathers, brothers, uncles, grandfathers, sons. It is a very, very critical role to improve men's health and overall public health. Thanks to both of you. And again, Stay with us with the Dr. Ridwan Show, health information you can use.